can I say how pleased I am to be joined by my parliamentary colleagues here, all of them having already been introduced, but particularly the Minister for Mental Health and Healthy Lifestyles who will speak shortly, and all of the very senior health officials here, but also many here who represent the districts that provide the services throughout Greater Western Sydney, whether it's southwestern Sydney, out to Campbelltown, Camden, whether it's the Nepean Blue Mountains, which takes us up to the mountains, or Western Sydney, which includes some of our biggest hospitals in the state. My vision, look, it's been made mention the fact that I've been living a long time in this health area. Yes, I became the Shadow Minister for Health in March 1995, and for my sins I stayed there, with the exception of 2 years in the middle where I shadowed education until I was we were elected and I was appointed not only Minister for Health but Minister for Medical Research in April 2011. And I recall shortly after that I was at a function where a former Labor minister sympathised when introducing me, saying I got the poison chalice. Well, I can tell you something, in my opinion, health is not a poison chalice. I think it is the best job in town. It is the toughest though, it's a challenge. But there's no more important area of government responsibility than the delivery of healthcare. And I'm very proud of the fact that we have some of the best people in the world working in New South Wales Health, whether they're some of the health officials, the doctors, the nurses, the allied health professionals and those who help them. Can I say that we have a system that provides more patients with healthcare than any other system in the country. We have a massive increase in demand, and the challenge is always putting the patient at the centre of everything that we do, using our resources to get the best possible outcome for the patients. And I know that's what drives our health clinicians, whoever they are in the health system. But in order to deliver that, we also have to make the working environment as good as we can, so that we have clinicians that are enjoying the work that they do. And one of the things that I talked about when we first won government, and I remember sitting up at Eden's Cafe up in Penrith, where with Stuart Ayres I'd visited a number of occasions with members of the Medical Staff Council up there, talking about our core values. CORE stands for collaboration, openness, respect, empowerment. And they laughed and said, "You don't seriously mean that we're going to be respected at last?" And I was horrified, frankly, that that's how they felt, that they'd been giving their all but not respected. And so that's been one of the driving forces from my mind. Now, I want to touch briefly on how we need to be, how we're challenged and how we need to be careful with the resources that we have. This year, the health budget is a record health budget. So what, you say? Every year's a record health budget. We have $18.3 billion in the health budget this year, 17.3 of that roughly in recurrent spending. It's 27% of the total state budget, and it's an increase of 5.4% on the budget from last year. As well as that, and it's distributed throughout the state through these local health districts that we've established, so that the people you see sitting up here are representatives of the hospitals in Greater Western Sydney. They've negotiated their budgets, they're provided under service agreements, and in a very short time they will be available, all of them, some are already, on the website, so that you can actually see how they've been funded and what services they're providing. But out of that money, the growth money that they've been given, there's an additional expectation that there will be money turned around from less efficient ways to less efficient services in health to more efficient ones. It's called an efficiency savings. It was a policy introduced by the former Labor government back in 2009, a policy I thought was worthwhile, which is why we've extended it and continued it. And what it is about finding better ways to use money to get better outcomes for individual patients, and then being able to roll that money over, because we keep it in health, we're not handing it back, we're keeping it, and then rolling it over to treat more patients. So over 4 years, that's $2.2 billion that will come back to the district or remain in the districts to provide additional care. And what we're talking about is additional frontline care. This year, 50,000 extra emergency attendances, 30,000 extra overnight stays, 2,000 extra elective surgeries. That's on top of everything that's already provided. The numbers are huge. And an example of what I mean about more efficient ways, new models of care as they're known in the health jargon. Well, recently there was a story in the paper about one of the local health districts which is introducing a program to shorten the stay of elderly patients in their acute beds in a hospital. And unfortunately the headline simplistically said, they suggested they were throwing patients out of hospitals early. No, this is a new model of care, a more efficient way of getting a better outcome for patients. It's called hospital in the home, where, as was described by the chief executive of that district, a patient that was previously spending 22 days in an acute hospital bed, not good for that patient, is able to be sent home 10 days earlier because hospital in the home is providing the support and the clinical care to enable them to be better cared for at home, better for the patient, and more efficient, so the dollars saved from those acute beds not occupied by that patient can be rolled over into treating more patients. That's what I believe is really important in the way we go forward. And I say that I'm thrilled when I go around the state visiting hospitals, talking to nurses, doctors, allied health professionals and others, that a lot of these ideas are coming from the bottom. They're coming from the ward, they're coming from the front line, so that the extra staff we've put on, and over the time I've been the minister, for example, we've employed 2,900 extra nurses, 2,900 just in the 18 months. Now that converts in an annual, in a financial year to about 1,500 equivalent full-time, but it's 2,900 extra bodies because some choose not to work full-time. We've employed more nurses, more doctors, more allied health professionals, and they're the ones that are delivering these services to our patients. Enough from me, Jim, but I just wanted to say they're the sort of things that we're doing. My vision for health is we do more of this, we can treat more patients, get much better outcomes. We're working with some of the pillars in the health system to improve quality outcomes, addressing things like hospital infections, working with the clinicians through the Agency for Clinical Innovation, which are the ideas from the clinicians in the field to provide a system that is much more effective in meeting their patients' needs with the most efficient use of the dollars, so we can actually meet future demand as it grows, and it will. So I'm pleased that you're all here, as well as having an opportunity to ask us questions during the panel forum. There will be some presentations from each of the districts here and the Children's Network about some of these innovative programs that are providing new ways, more efficient ways of treating patients. And I hope you enjoy the evening. Thank you all for coming.